Thank you, Tom, and good afternoon. I'm happy to report that there are now 5,205 Albertans who have recovered from COVID-19, leaving 1,131 active cases in the province. Currently, 65 people are hospitalized, with 10 of those admitted to ICUs. We have confirmed 50 new cases out of 4,816 new test results completed over the past 24 hours. Sadly, I must also report one additional death of an individual in a Calgary continuing care facility. This brings the total number of COVID-related deaths in the province to 121. My sympathies go out to all those who have lost loved ones during this time. There are 100 active cases from outbreaks in continuing care facilities and 569 residents who have now fully recovered. We continue to monitor all of our outbreaks very closely, working with the operators to contain the spread and making sure that all public health measures are being taken seriously. Many Albertans have questions or may be unclear about what Stage 1 of Alberta's relaunch strategy means for them. I've also heard concerns from Calgarians and residents of Brooks who are feeling that it is unfair that we are taking a more gradual approach to relaunch in their communities. I want to reinforce that the recommendations I have made are never taken lightly. Since last week, we have been focusing our planning on a balance of protecting the health of Albertans from COVID-19 and the health of Albertans from the impacts of a prolonged shutdown. If we move too far in either direction, neglecting the other, our outcomes will be worse. Our best path is in seeking that balance and making adjustments along the way. As I drove into the office this morning, I could see signs of preparation for business resumption today. No matter where you live, I'm sure you have seen some retail businesses that are opening their doors to customers. Perhaps parents who are planning to cautiously drop their children off at daycare or an out-of-school care program. Earlier today, the Royal Tyrrell Museum and the Royal Alberta Museum opened their doors to guests. In communities outside of Calgary and Brooks, coffee shops and restaurants are able to open at 50% capacity, while others, including those in Calgary and Brooks, are choosing to continue to offer pick-up or take-out options. Hair salons and barbers are taking appointments or preparing to welcome customers. For Brooks and Calgary, these businesses will be able to resume on May 25th. I understand having to wait the extra 10 days is frustrating for residents of these communities. The reason for this 10-day wait is to allow us to monitor any increase in spread caused by the opening of retail, daycares, and other activities in these communities where there is a higher baseline rate. Although a full incubation period for COVID is 14 days, in other jurisdictions where reopening has started, it has been possible to see a rapid rise within 7 days where there have been problems. This relaunch will require patience from all of us and continued practice of public health measures so we can continue with our relaunch plans as quickly as possible. I have also been asked for clarity on what businesses are allowed to open in Stage 1. All businesses that are not specifically named as opening in Stages 2 or 3 are included in Stage 1. You can find the Stage 2 and 3 lists on the Relaunch webpage. But let me be clear. Businesses starting to reopen does not mean it's back to normal. We will need to support each other's health and safety by practicing physical distancing, frequent hand washing, and other measures. This will not change, and this is our new normal. If you are a business owner, please know that you have flexibility in choosing the right time to open after the stage that your business is in begins. And you must feel confident that you are reopening at a time that is safe for you, your staff, and your patrons. I know many business owners and facility operators have questions about what they can do to help mitigate the risks. At the same time, Albertans have asked for greater reassurance that the businesses and facilities they visit are following public health precautions. That is why, as a part of the relaunch strategy, we are requiring anyone who is reopening to identify what they are doing at their site to reduce the risk of transmission. Within 7 days of opening, businesses must fill out a short template that can be found online at the BizConnect site and post it at their place of business or online. Places of worship and funeral services will be required to do the same. This action is intended to give a clearer sense of what measures are appropriate for each location, and to reassure customers and staff that each business is taking appropriate action to protect their health and safety. I encourage businesses to visit the BizConnect webpage and download the template, and also review the Government of Alberta's guidance for all business owners, as well as any sector-specific guidance that may be applicable. We will continue to update this page frequently with new guidelines and information. I have also been asked to clarify the difference between restrictions on the number of people allowed to be in a particular place, with different numbers in different contexts. First, let me say that we have taken a risk-based approach to setting numbers in Stage 1, and that one of the key factors in differentiating between settings is the presence of a responsible or accountable party for a setting. In restaurants that are opening for dine-in service, the maximum number of patrons allowed is 50% of the total capacity, with no more than 6 patrons per table and 2 meters of distance between tables. While there could be more than 15 people in that room or that business, the expectation is that each table of 6 is distanced from the others and that dining parties are not interacting with each other. Restaurant owners and managers are responsible for ensuring that the space is set up in such a way to facilitate following those spacing rules. In places of worship, we are allowing 1/3 of the typical worship attendance, or 50 people, whichever is smaller, to attend a worship service with additional restrictions in place, such as no group singing. Again, in this setting, there is an institutional responsible party who is accountable for ensuring that communities of faith are following the distancing rules, sitting separate from each other, and not engaging in socialization before or after the service. I know this will be very difficult for these communities, and I ask that they choose other ways to show their friends how much they have missed being together, perhaps connecting by phone before or after a service, or other creative ways to connect. We have not set a single maximum number for retail stores, as each setting is a different size, and one number would not suit every setting. Retail businesses are responsible for ensuring that their measures, which may include limiting the number of people in their store at a given time, make it as easy as possible for patrons to stay 2 meters away from others at all times. Finally, the 15-person rule that we have been following for months continues to apply to any gathering where people are coming together for a common purpose, where there is no single person or organization who is accountable for ensuring that public health measures are implemented. Social gatherings with 15 people or less can take place as long as those attending remain physically distant and the attendees are not sharing food or drink. Before I take questions, I'd like to talk a bit more about the use of masks while out in public. In the coming days and weeks, we can expect more and more Albertans to be out and about, eating at restaurants, walking through shopping malls, and visiting museums, as well as enjoying some of Alberta's beautiful trails and park systems. In these public spaces, physical distancing might not always be possible. However, wearing non-medical masks can help limit your exposure and protect those around you. Remember, even if you were feeling fine and showing no signs of symptoms, you may still be able to transmit the virus to others if you have been exposed. Wearing a mask in public settings is a useful measure to protect those around you. The mask will keep any respiratory drops that you may put out, and think of those as when you breathe out on a cold day, what you can see in the air, that's your respiratory drops, and the mask can keep those from contaminating people, surfaces, and objects. Let me be clear, wearing a mask does not replace other important measures. If you are showing any COVID-related symptoms, you must still isolate. Other measures, such as physical distancing, whenever feasible, frequent hand washing, and covering any coughs or sneezes are still essential. Think of masks as that last line of defense in the event other measures are not possible. As I mentioned yesterday, guidance is available online that provides some general tips on how to properly wear and care for non-medical masks, as well as some general advice on how to create your own if you wish to have a cloth mask. I strongly encourage you to review these guidelines and to think about where in your daily routines you might be able to adopt the use of masks. Taking public transit to and from work, or stocking up on groceries are a few examples. Please consider mask usage in any public situation to limit the risk to those around you. In the coming days, I will have more information to share with you on this. We are entering a new world together, and we will succeed by supporting each other through the challenges that Relaunch presents. We have never needed each other more than we do now, and we will get through this together. Thank you, and I'm happy to take any questions.
All right, we'll now go to the phone. In addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Medical Director and Vice President with AHS. Operator, could you put through the first question, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. You just spoke about masks. Several businesses in our province are now mandating customers wear masks when inside. Why haven't you made that a requirement for residents when leaving their homes rather than a soft suggestion?
So I've had that question quite a bit in terms of making a rule or making it a legal requirement. And I think that the importance of wearing a mask is in addition to all the other measures that are required. I've seen more and more people wearing masks as I've been driving to and from work, and I think that a strong recommendation is having an impact. I think that we'll continue to watch the impact that the recommendation has. And I also note that while the evidence indicates that mask wearing can provide some additional benefit, there are also some risks if people do not wear masks properly. So I think we'd have to think very carefully before requiring them by law. But again, I think that I see Albertans out and about, many of whom are wearing masks already, and we'll continue to encourage that to happen.
Operator, could you put through the next one, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. You said last week that as we relaunch, people will interact more and there's more chance of spread. So what should we anticipate now that most of the province is in stage 1 in terms of cases and when numbers might go up? And then further to that, how contagious or what was the R naught of the virus when the pandemic first started? What did it become as we all stayed at home, and what should we expect as Alberta begins to reopen?
So good questions. I think that it's difficult to know exactly what will happen with respect to numbers, and just like we talked about with the modeling and talking about how those were simply projections, but that the reality is in the hands of all Albertans, I would say the same with Relaunch. I do think that with more people out and about and interacting, there are more opportunities, more chances that virus could spread. But the more that we all together can follow the advice, can keep distant, can wear masks, can wash our hands, the less likely we will see a sudden spike and increase in cases. So what I'm hoping for is that we will see cases that they may go up a little bit, but that we'll be able, through our collective actions, to keep those numbers relatively flat. That would be my hope. And I guess we will watch and see. As I said earlier, although the full incubation period is 14 days from exposure, we can see increases in cases within 5 to 7 days of a change in people's habits and patterns, because you can start to see cases again within a few days of exposure. So I think by late next week we should have a reasonable idea if we're going to see a sudden sharp increase. But again, my hope would be that we keep the numbers relatively flat. With respect to the R naught, or the reproductive number, how many new cases a single case generates, I don't have the exact R number for where we were at the very beginning of our experience with the pandemic. What I can tell you is that the R number, the reproductive number that was calculated earlier this week, was 1.2, so still slightly more cases generated from each new case than we would like to see. Again, we'd like to see that at 1 or lower. And so we'll have to be watching very closely to see how that trends over time as we move into relaunch. But again, I want to say that I think that Albertans have done a tremendous job so far, and that we can continue together to keep the spread of the virus relatively flat or even decrease. And that would be a tremendous accomplishment that we could do that together while we open our businesses.
All right, before we go to the phone line, just a small correction. My apologies. The Royal Tyrrell Museum will open on Saturday, and the Royal Alberta Museum will open on Saturday, and the Tyrrell next Friday. Additional information is online. Operator, could you please put through the next caller, please?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Dr. Hinshaw. Today, at a City of Calgary news conference on COVID-19, we were told the following, and this is what Calgarians were told. We didn't get to go forward because we didn't drive the rate of COVID-19 down. Collectively, we didn't do that. And then we were also told that we've got to get 30% better. We need to double down. This is in Calgary only. What is your reaction to Calgarians being told that they have to do more if we're to get the gold star or the green light on May 25th? I want to get your reaction to that. That's all.
Sure. So, I think that the challenge is understanding exactly what has been driving the numbers. And I think I've mentioned before, we know that the early numbers in Calgary were higher than the rest of the province, likely because there are more people who travel internationally in Calgary than in the rest of the province. I think that part of the challenge we've had in Calgary as we've been trying to pin down cases has partly been the fact that, one of the possibilities is that with some of the early travel introductions, we didn't necessarily know about places in the U.S. that had cases. And so I do wonder, this is a theory, and I'm not sure that we'll ever know for sure, but if we did have introductions in Calgary early on that were relatively mild and perhaps caused some spread that wasn't detected, that we're still having a hard time pinning down. So there's lots of theories and possibilities. What I would say is that in Calgary, we have seen relative stability or kind of a flattening of numbers. We haven't seen that declining as much as I think we would all like to see, but we also haven't been seeing a steep increase in the last few days. So I would say that Calgarians are working hard already, and that collectively, again, by making sure that we're all supporting each other, that if someone is feeling sick, that they stay home, they get tested, and that contact tracing can happen, that the possibility for Calgary to be catching up with the rest of the province in terms of having lower numbers, I think that's very doable. So I guess I would like to encourage Calgarians to see the relative stability as an encouraging sign and to work hard to get that to trend down, but in a supportive way. I really want to encourage not just Calgarians, but all Albertans, wherever we are, to be thinking about how can we be kind and compassionate and support anyone who does need to be isolating, anyone who's feeling sick. How do we make sure they have all the supports they need to do that? Because I think that we'll be in trouble if we take an approach that is punitive and makes, whether it's people in Calgary or elsewhere, feel like they need to hide their illness or that they're ashamed, because then it will be even harder to get a handle on it. So that I guess I would hope that Calgarians can feel like this is doable, and if anyone can do it, Calgarians can do it.
Operator, could you put through the next question, please?
Next is Michael King with Global TV. Go ahead, Michael. Michael, hello?
For Greenbrooks.
I'm sorry, we're having trouble hearing you, Michael. Could you try that one more time?
Are we getting?
All right, Operator, could you put through the next question? And Michael, if we don't get to you, feel free to reach out to me directly.
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Good afternoon, Dr. Hinshaw. Plenty of Calgarians can drive to these neighboring communities to Calgary, like Airdrie, relatively quickly, faster than they could even get downtown. I'm wondering whether this risks spreading infections in Calgary to these communities and what the thought process was behind exempting Airdrie, Okotoks, Strathmore, etc.
Sure. So when we were looking at the numbers, we did have a conversation about where to draw that line, and it's always a challenging discussion because, as you say, the city limits of Calgary, there's many communities right around that area. However, if we had drawn that line around those communities, there would be yet still another circle of communities immediately outside of those. So the decision that we made was really driven by looking at where we had the most cases and particularly spread where we didn't know the source of the infection. And the decision to make the City of Calgary that line was based on the fact that it's really only a 10-day difference between the first opening today and the next opening of restaurants, bars, and hairstylists. And also to know that all of the retail services that are opening across the province can open in Calgary as well. So thinking about what kinds of services Calgarians might want to drive for, again, I think that the risk is mitigated by the fact that all of those extra retail services are opening with no difference, and that it really is only just that 10-day wait for people to go to their own hairstylist or to wait to go to their own favorite restaurant in town.
Operator, could you put through the next caller, please?
Next is Laurent Perreault with Radio Canada. Go ahead, Laurent.
Hello. I was wondering how you would characterize the compliance you are seeing right now, and I'm thinking maybe you could talk to that in terms of what you've seen today, but also maybe what you've seen in the last weeks.
Sorry, the complaints that we're seeing, is that what you're asking?
The compliance.
Oh,
of
compliance.
Your guidelines.
My apologies. So, I think that the information that I get is mostly from the people that I work with, the frontline public health people, and so we have had some reports of, for example, businesses that have been opening in earlier stages than they're allowed to, and the public health teams are making sure that those businesses are aware that they need to wait for a further stage, and making sure they have that information and that they know that it's not optional. In terms of compliance of, say, physical distancing or other measures that are more at an individual level, I've seen many more people wearing masks, certainly seeing people still following that 2-meter rule for the most part when people are out for walks. I've seen that there's small household groupings, but that they do tend to stay distant from each other, different household groupings by 2 meters. Now, I will say that in terms of what I have seen, I am mostly at work, so I guess most of what I've seen is observing that distancing at work and then as I'm driving back and forth. But it's not been reported to me that there has been widespread challenges with compliance to date. And I think that it's really important for all of us to remember that the way that we succeed in this relaunch is by continuing to follow these public health measures while we move into opening up our social and economic lives so that we can have that holistic approach to our health.
All right, we've got time for 2 more questions. Operator, could you put through the next caller, please?
Next is Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. I just wanted to ask you about the asymptomatic testing that you announced for Calgary a few days ago. I'm wondering if you can give us a sense of what kind of response you've received to that in terms of the number of people coming forward. And what are the numbers showing you in terms of the number of asymptomatic cases that are out there and potentially the transmission rate, some of that information that you might have been looking for?
Sure. So we've had a tremendous response, actually. Many Calgarians who've been interested in registering for testing through that call out. So as of this morning, we had almost 6,000 Calgarians who had already signed up in just 3 days. We haven't seen yet, so the numbers, so what happened, we announced it on Monday afternoon, And then what happens, people need to go online. Through the online form, they register. They get a call back to book their appointment, and then they go in through the assessment center to get the testing done. And so there is a little bit of a delay between when they go online and book that appointment to when the testing is done, then the swab goes to the lab, and then we get the results. So I anticipate I'll have some early data to share tomorrow on the results of that first day or so of where the asymptomatic swabs have actually been run through the lab. But I don't have that information right now. But we, again, have had a very significant response from interested Calgarians who want to participate in this.
Operator, could you please put through our last caller?
Final question is Brenna Rose with CTV News. Go ahead, Brenna.
Hi, Dr. Hinshaw. My question is in regards to recovery. So we know that more than 5,000 Albertans at this point are considered recovered. We've obviously seen that people react very differently to this virus. And is there any way that you can give us a sense of how many of these recoveries are still having lingering effects?
So it is a really good question. I don't have that data for Albertans specifically, but I know there is starting to be some emerging evidence of some of the potential longer lasting effects of the virus in some people. We've seen some reports from the US about children who, after having been infected with COVID, at a later point in time can have an inflammatory condition that can happen kind of post-infection. And so that's one kind of group of symptoms that we're seeing in kids. We know that for some people, there have been issues with, for example, kidneys, seeing some of that emerging in the evidence, but we are still learning about this. And to date in Alberta, we don't have the data on those recovered people to be able to say whether or not we're seeing significant increases in some of those conditions. To my knowledge, we haven't seen similar increases, and I will say that in New York City, where some of these the children having this inflammatory condition were identified, they had many more cases than we did. So it is still a relatively rare phenomenon. However, we will be watching for some of these things and want to make sure that we are understanding some of those long-term impacts. So again, more information to come as we learn more about the long-term effects.
Thank you for joining us, everyone, and we'll provide another update tomorrow afternoon.